Hi, everybody, and good evening. It is December 17th, 2014. And actually, this will be our last broadcast of 2014 because I'm on vacation the week of Christmas, and then I won't be back from traveling until until New Year's Eve. And I don't think that's a good night to run a webinar. So our next webinar I'll be on January 1st, the evening of January 1st, 2015. So my thought tonight was I wanted to talk a little bit about our parent support groups, and I wanted to talk about what I've learned from them, what happens at them, the evolution of them. I'm fresh off a parent support group last night in Chicago, so that left for me an impression, and I was paying attention last night to the different ways that I think about and run, and that we participate in parent support groups over the years since we started them, and I think it was around 2007, 2008. So that's what I'm bringing is lessons from and something about. This might be a webinar that parents would want to watch before they come to the parent meeting because I will talk about some general guidelines, but also for those of you who haven't had a chance or might never have a chance to come to a parent support group, it gives you an idea about what we talk about and work on in those workshops or in those parent support groups. So originally the thought was people just needed more connection. And I thought it was going to be more of a networking thing, and that can happen at a parent support group where people meet each other and end up exchanging phone numbers, or sometimes people will share the local meeting that they go to of Al-Anon or Codependence Anonymous or Families Anonymous that they find really helpful so other people can learn about that. But it was really not even a really conscious plan. We just knew that people wanted to get together. It came from our early days of having mentors, where people really talked about how they enjoyed both being a mentor and talking to a mentor in those first few days. So we wanted to build a community, and my thought was that there would be a lot of instruction and a lot of teaching. I learned quickly that people need to tell their stories. And I've experimented with parent support groups where we have long introductions, sometimes almost taking the entire 2 hours. And then I've had parent support groups where we cut that way down and really limit the amount of introduction. And what I've found is this over the years, is that if people don't tell their stories, they'll tell them anyway. They'll tell them by asking a question. They'll give some background to a question that they might have. And so what I learned over some time was that people needed to be in a place where they could tell their story and be heard and not be judged and be understood by other people in the process. So when you go to a parent support group, that's one thing that is offered at all of them, is that you have a chance to tell your story and listen to the story of others. But the fact of the matter, what I learned is that I can't create a perfect structure for everybody that fits everybody at every meeting. Sometimes somebody needs to talk a lot. Sometimes people just want to hear what I have to say, or a message or some skills or curriculum. And so what I've learned to do is kind of go with the flow and realize that there's going to be people that need to do a lot of talking. What I hope for parents, and what we practiced last night, is recognizing that not everybody goes through grief or stress the same way. And while you might not need to say much, somebody else might need to see a lot. And I will reserve time in every parent support group. Last night we did about an hour and 15 minutes of people sharing their story, and then about 45 minutes of me talking and reflecting on the principles and the issues and the themes that came out in the introductions. And there was some dialogue during that also, and question and answer, but a lot of that was me sharing stories and me sharing examples and me sharing some principles with them. And I just learned that I can't create a perfect one. I used to do this thing where I would have a Northern California parent support group, and I would think, oh, this is the way it should be. And then I would go down to Southern California the next day, and I would use what I learned the night before to Southern California, and they asked me to do it exactly like we had done it in Northern California, or the opposite of Northern California. So that's something I've learned from it, is it takes on its own life. One thing that can happen, and it's hard to do when we have these open groups where people don't necessarily commit to coming every month, and you're welcome to not come for several months and then to come, is to be able to learn from other people's work. To be able to say, okay, this is what this person has been going through, and I'm watching them, and I'm watching what they're doing. And one thing we know about multifamily groups or group therapy in general is that you don't always have to be the one whose issues or work is being focused on in a particular segment or discussion, and you can get something out of that. So that's one of the benefits of it, is that we get to learn from other people's work. And I think about it this way, and this is a strange, when I was writing this slide and these two sentences, I thought it might sound strange, so I'll explain it, but we want to take care of parents, to provide something for them, to provide a place where they can share and talk and ask questions and grieve and feel and express that, so that their children don't have to bear that. it was so fascinating. We had a teenager come to the meeting, and that's not what we make these meetings for. So this was an exception to the rule. This teenager come, and during the introduction process, the father said, "My son here, he convinced us, told us that we needed to go to Families Anonymous," and this was the sibling of the person that had been at our program. So he said he told us that we needed to go to Families Anonymous, and I said, "Why?" And he said, "I could just tell that they needed that. My brother put us through so much stress, and they were going through so much that I encouraged them to go out and get help at these meetings." And I inserted a tongue-in-cheek comment where, "That's nice that you didn't have to take care of them, that they could begin to take care of themselves," and everybody chuckled. But that's a really important part of it. And there's so much that our children are struggling with in terms of sorting themselves out, figuring out their symptoms, figuring out where the wounds and where the hurts are so they can feel their way through it and stop using symptoms to cover them up or to express it. They're doing so much of that work that if there's a lot of parental need that's in the equation, it's very hard for them to get clear. And that's part of the reason for placement, right? So it's a place where you can go and get yourself taken care of. I love this quote. Thinking about the first thing that a parent does at this meeting is begin to find and take care of themselves. Make no mistake about it. Enlightenment is a destructive process. It has nothing to do with becoming better or being happier. Enlightenment is crumbling away of untruth. It's seeing through the facade of pretense. It's the complete eradication of everything we imagine to be true. So a lot of what we learned at this meeting, and last night was a great example, is that there's a lot of things that get in the way of us knowing. People had questions or dilemmas that they shared. What should I do next? How do I make the transition smooth? Well, how much do I write my son? He's not writing very much. Those types of questions. And one of the questions I asked early on in the meeting is, why don't we know? Not you specifically, but people in general. Why don't we know? And comments like fear and guilt and anxiety were brought into the discussion. One mother finally said, some of it might come from our own history. And I made the joke to say, it all comes from your own history. It all comes from your background. But there are things. One mother talked later in the meeting about what her community says that she should do, or what her son says that she should do. So there's all these voices, all these directions, all of these experts, right? Parents from our background, people in our community, therapists, our children, all these people have all this information about telling us what to do. And for a long time, we've lost sight of us. We've lost sight of the mission of finding and refocusing in this diligent, committed, programmatic almost process of always trying to find ourselves first. And then from there, we can begin to see the other person more clearly. And then from there, we can make decisions about what our rules and consequences are, because we're not focusing on changing them when we make a decision around consequences. We're focusing on what we feel is best, what our intention is, what's the strongest message, what do I feel comfortable with, instead of what key do I need to turn, what button do I need to push, what lever do I need to flip so that I can change my child into this positive direction. Instead, we ask the question, who am I? And like, I don't know how to say that name over there, Adyashanti says, we go through this process of peeling away the things that get in the way of us and our wisdom. These are some concepts from my book, The Journey of the Heroic Parent. There's deep wisdom hidden beneath the symptoms your child is demonstrating. If we don't embrace the journey, we might miss it. It is a call of sorts. It is a call to stretch yourself, to feel things, to walk into rooms beyond your comfort, to walk the road less traveled. Through this process, we learn of the world that lies beyond the limits we believe are the edges of life. So our children and their problems take us to these other places. And parents who go through it, and I know when you first start out at this process, and if some of you are new, my response is just keep coming. It'll make more and more and more sense to you. And it's difficult in an audience to talk to somebody who put their child in our program yesterday versus somebody who's been out of the program for 3 years, because they're at different points in the journey. So for you new parents, keep coming. Keep coming to the meetings. Moving on. In the process of attempting to save our children from their seemingly impending self-destruction, we are transformed. This transformation includes the development of greater compassion for others and ourselves. The transformation is to a larger person, a changed person, with more insight into the way that life works. And this transformation is like a realignment with our true selves. We are invited to embark on the path of enlightenment, a destructive process where we remove all the untruths we absorbed in our pre-problem, pre-crisis lives we were living. Enlightenment is awareness of ourselves, others, and our participation in the problems others and we have created. together in a dance, in a cycle. So part of what we're doing in these meetings, we're inviting you to think about it differently. We're inviting you to think about even what it means to be in a parenting class or to be participating in parenting education. One of the things I like about webinars and also this group process, so when I'm talking on webinars, I know you can type in questions and pass them on to my moderator and I can get them at some point, but I think it does a couple of things. It almost removes some of the energy that might lead to defensiveness because I'm not talking necessarily to you only. And so if it doesn't fit, maybe you can just not take it on right away, right? If it doesn't seem to apply, you not take it on. And you're not actively defending yourself per se because I'm speaking to a group. But I also provide you, because you don't immediately need to or have to reject it, it also provides you with the benefit of it can just sit there. It happens to me in therapy sometimes, even though that is one-on-one when I'm going to my therapist, where she'll say something one week and I think at the moment I don't agree with that, but then I think about it all week and I start to see it in a different way. And I start to digest part of it and I start to see the relatedness to my issue that I'm having that time. So talking to groups helps you in a way that therapy doesn't, or that a dialogue might not in many ways, because you can just try it on for size, and if it fits, great, and if it doesn't, it doesn't. So there's less, in many cases, likely that there's going to be defensiveness, although I have had parents tell me that they've been angry at me during the webinars. That happened last night, actually. I've had people that they've been angry at some of my suggestions, but I didn't know it. And so we didn't have to have that discussion. And they just had to grapple it with them themselves. So that there is a benefit to this form of therapeutic education. One of the things that we want you to do when you walk into these groups, and this is really hard, but I want to be really clear about this, and the children in our program all learn it. It's really a part of all therapy. And that is speak from the I. And what I mean is, like, let's say your child had dropped out of school and wasn't going to school. Okay? Instead of saying, you know what it's like when your child's not on the right path and when they're not going to school, they do something. Instead of saying that, say, I'm struggling. I am struggling because my child is not going to school. Me and my husband don't know what to do, and I'm afraid, and I'm angry, and I'm frustrated. And I don't know if you can see that or feel that, but it feels so much different. And again, it's a small skill that actually makes me as the speaker begin to think and reflect and share more instead of intellectualize myself and distance it from it. It's more vulnerable, it's more real, it's more personal. So try when you're sharing. And I mean this all the time. Try to, when you're talking about yourself, talk about yourself. When you're talking about someone else, talk about somebody else. But this way of distancing ourselves from it by saying, you know how it is in life when you do this, and then you do this, and then you wake up, and then this, that's not really sharing. That's intellectualizing the process. We don't want advice. That's not the goal of our meetings. That's not the goal of Al-Anon. That's not the goal of AA. That's not the goal of any group, really. At least not any of the groups that I participate in or run, for sure. I can share you what has worked for me. But to tell you what to do is not a part of our method. And the example that we were talking about last night in the group is a couple of parents at that stage in their process where, do I lock my adult children out of my house? Do I kick them out of the house? And there's fear that something horrible could happen to them. Or do I let them back in my house? And then there's fear that I'm reinforcing, perpetuating a dynamic where I'm rescuing them. And that example illustrates an important point. I don't know what you should do, because I don't know what's in your heart. I don't know what you feel good about. I don't know how exhausted you are. I don't know if you're ready to let go of the outcome. If I convince you to take your child in and that reinforces something that could be very destructive, that's not my decision. And if I encourage you to do something else, like lock him out or kick him out, and something horrible happens in that context, I can't be responsible for that either. What I can do is engage you in a process, in a dialogue, and a series of questions that helps you find out where you're at. And what I can do is help you begin to see places that you're holding on to that you can't control. It isn't about, in this example, fixing your kid. It is about, in this example, being honest, true, having integrity, being as wise and thoughtful and mindful as you can about your decision, and then deciding it. And then turning over how your son or daughter reacts to it to them. And that's frightening to do. So we can talk about what's going on. I can help you realize the truth that is hidden behind fears and control and anxiety and guilt. But I can't tell you my truth. I can't give you my answer. I can't tell you what to do. And I don't want parents doing it with each other either. I want us to be more patient and not to come up with quick solutions. Sometimes, even when I'm having a dialogue with a parent, when I'm doing some parent coaching, sometimes even when I have an early glimpse about a line of thinking or questioning or ideas or a path that we might go down, I've learned, and somebody else taught me this, listen longer, right? If I have somebody in 5 minutes into the phone call, I start going down my path. I haven't given them the space to do what part of what they need to do is they need to feel. They need to sort themselves out. They need to talk their way through it a little bit. So let people talk. Don't give advice. You can share wisdom or experience from your own life. Here's what I've learned. Here's what worked for me. It might not work for you. And include that second part. This is something that I did not exactly like yours, but that I learned. It may not apply to yours, but it's my thing. And here's what I've learned. So share wisdom. Ask for wisdom. Beyond just asking a question like, I don't know what the next step is and I want help with that, or how do I make it a transition? That's okay. Those are kind of the tip of the proverbial iceberg. I think what I want people to do is share their dilemma. Here's what I'm grappling with and why. I'm afraid of this. I don't know how to do this. And I'm getting all caught up in this and that. The next step in aftercare, and we're at the point where we're deciding, and I'm afraid that I'm going to lose him. I'm afraid that he's going to be far away from me. I'm afraid that I'm going to make a program choice that he's going to resent me for, or that's not going to be a good fit. You know, his wilderness therapy program was fantastic, but I'm not sure how to make this next decision. That's just a deeper way of describing all of the complexities that you're dealing with instead of, I want to know where to go next. Okay? And that, talking about it that way, but more importantly, thinking about it that way and engaging the dilemma that way invites a more complex process and more work. And then these things, then we'll be translating this kind of work to something that happens tomorrow or the next day. Because if I just answer questions or you just get questions answered, I don't think there's a lot of learning in that. And I want all of our parents and all of my clients to have a sustainable source of wisdom. And that sustainable source of wisdom is you. And that sustainable source of wisdom is figuring out what's getting in the way of you seeing yourself clearly. So bring a dilemma, bring something. You know, bring, I want to share something. Or bring, I just like feeling and being here. It doesn't always have to be a difficult thing. This is so difficult. Share your story. Of course, you're going to share the context of your story, where you're at in your life, by giving some brief sketch of your child. But these meetings are for you and your story as they relate to your child. They're not your child's story. And that's both a subtle difference, but also a very, very important difference. And I see it all the time when I ask a parent how they're doing. And we're meeting in the context of, I'm a therapist or clinical director or parent educator, and they're a parent of a child who's struggling. That's the context. So that admittedly implies certain things. But when I say, how are they doing? I would say 7 times out of 10, the parent goes into describing how their child is doing. That's important to recognize. And again, I'm not judging that, but I am identifying that can be evidence of us losing the focus of our work. So a lot of times after they tell me where their child is doing, I say, well, how's that for you? What's going on for you in this process? So be conscious of that. And your child needs you to be on your story. They need you. It helps them so much if you can make your story your project and not theirs. They don't need the added burden of being your story. They don't need the added burden that they're responsible for the ups and the downs of your life. They don't need the added burden of the discouragement and the depression and the anxiety that you experience, that is yours, when they struggle. They have enough that they're struggling with. So they need you to own your story and to get on your journey. I think coming for meetings is a piece of accountability for yourself. I don't necessarily make parents accountable or ask them to report in on themselves. But it's a time to say, here's what I'm working on and doing well with, here's something I'm progressing about, and here's something I'm still struggling with. and I want to get around this corner, or get over this hump. And again, I'm not talking about get around the corner of, like a lot of parents talk about, when are we going to be done? When are we going to be back to normal life? And my answer is hopefully never. Hopefully you'll never be back to normal life. Hopefully you and your child and your family get on this road less traveled. But I think parent support groups, our parent support groups, can be a piece of, or what is invited in you, is to make that a part of your accountability check-in about how you are doing. I can't say it enough, how you are doing in relationship to your child's struggles. Now, that's there, but it's how you are doing. And by the way, we say the same thing to them. Everything I'm saying to you tonight, essentially, we teach them all day long, every day. So it's an extraordinarily close and parallel track that you all are on. And we come to remember. I learned from the meeting. I was telling somebody last night, one of the parents after the meeting, that sometimes they'll say, "Oh, that was, that thing you just said was great," and I'll say, "The thing is, I didn't know it 5 minutes ago. It came to me because we were talking." And so I get as much out of these meetings as anybody. And I'm so grateful for all of these meetings because they remind me of the lessons, of the principles, of the tools, of the insights. They remind me to do my work. They remind me, when I see it in a parent, when I recognize it in a parent, I recognize it in myself. And that's really part of really what any wisdom I have is I've done and am doing a lot of the things that parents are doing for better and for worse. So I can see it in other people very clearly because I battle, right? I struggle too. So we're trying to get out of our old context, and what I mean by that is where we grew up in our family and where we grew up in our culture. We're trying to challenge that context, right? To ask questions of all of it, to consider discarding any of it at any given point, if it's going to lead to our being more happy, more serene, more peaceful, more connected, more capable as a human being, a spouse, a friend, a parent. We're trying to interrupt this old wiring, and that's why I like the word wiring, because it doesn't just change with a message. It changes with a lot of reinforcement and a lot of repetition. So coming to a meeting, it's kind of a version of Codependence Anonymous. It's a little bit different because there's a teacher, there's a leader, whereas at a Code meeting, it's really more of a group process where everybody's sharing. But it's like those meetings, Families Anonymous, Al-Anon. You can find out about many times, and just remind me in the meeting if you're there to ask the question. I'll ask and I'll say, is anybody willing to share with everybody else a meeting that they go to that they like? And people raise their hand, and then you can look around and say, I'm going to go ask a couple of people. But it's kind of like that. It's the same type of work. I think meeting other normal, crazy people from all walks of life, like, the person next to you looks normal, seems happy, seems successful, and they're struggling too. And the walls that we build, I'm not talking simply about the psychological walls. I'm just talking about the way our culture is, the way our homes are, the way our society is. The walls that we build between each other are contrived and unnecessary. And I get it, because I do it. But part of what this process does, this community that we've created does, it allows you to more deeply connect to your virtual neighbor and to understand that you're not alone. But there's so much pretense in our lives, right? Most of us, all of us really. I'm just saying that so someone doesn't get defensive, but there's so much pretense in all of our lives. We have messages about we have to get it together. We can't be weak. We can't cry. We can't struggle. We can't be confused. We can't not know. And coming to these meetings, we learn to know that it's okay to not know. And that sometimes the not knowing wisdom is some of the greatest wisdom in the world. It's something that our child actually thrive with, is when we can embrace the not knowing and the vulnerable. And deal and grapple and sometimes win and sometimes lose with our own fears. I think it's partly about moving past stigma. The people that have stigma towards mental health are usually the sickest people that I meet, for sure. And this translates to gurus in history, right? Most of the enlightened ones that have walked on this earth that people look up to are aware of their own stupidity. And they're much less ashamed of it than you and I are. So I think this stigma is something we have to fight. It's one of our dragons, as Joseph Campbell would say. It's one of our ghosts from the past, is to say, where'd that message come from? Who says I have to be perfect or healthy? I love the idea in the book Parenting from the Inside Out, where they point out from their research, you don't have to have an ideal or even a healthy childhood to be able to make sense out of it and to be able to provide healthy attachment for your children. Part of it is learning how to process it. So we all have stuff. I was saying to a parent just the other day, the older I get, I realize my mother was crazy. She was crazy. Our childhood was insane. And the older I get, the more I realize that. And here's the coolest thing. The older I get, the more I realize it, the closer and more loving I feel towards her. The more forgiveness that I have. Because I realized she was wounded. And I realized I'm wounded. And I realized there's crazy stuff about me with my children. And there's no shame or guilt or blame in any of that. I'm just getting to a place in my life. I love this part of growing older. I'm getting to a place in my life where I can say, yeah, stuff's mixed up. And it's okay to look at it. And I don't have to bury it beneath shame and guilt and fear of rejection. It can just be. And if people have a problem with that, I don't need them in my life anyway. Right? That's not my people. So this stigma thing is something that's one of these things that we fight in our families, and that your children are inevitably or unconsciously asking you and themselves unknowingly to face, to confront. I've said this for years. I used to start every parent meeting. Consider, at least for the 2 hours in the parent meeting, that you're not off course. That there's something that out there that doesn't necessarily should be. I didn't say that correctly, I know, but that there's no should path. It was supposed to go like this. So much of human misery and suffering is not embracing what is. I didn't want to have this disease. I didn't want to have this job situation. I didn't want to have this child with this problem. I didn't want to have this adopted child with this other problem. I didn't want to have this marital problem. I didn't want to have these things, this health concern. But I do. And so I'm going to see what it's going to teach me, what I'm going to learn from it. What's the new thing that I get to learn from this gift? And in the case of your child, from their symptoms, from their disorder, from their struggles. So if you consider the fact that you're not off course, you're much more likely to access this. We call this in DBT and Buddhism, it's called radical acceptance. Okay? In Christianity and other faiths, it's called faith. In the Jewish religion and Islam, it's probably called faith. That means that in Buddhism, the universe is not making a mistake. I just need to line myself up with it. And in faiths, in religions of faith, then it would be more like God hasn't forgotten about me. And if that's true, and God is watching out for me and knows what's best for me, then I need to figure out how to get in line with that. Not ask him to change it necessarily, but I need to get in line with that and learn what I need to learn from. He's talking to me through this stuff. So I think those are very paralleled the ideas of faith and radical acceptance, and existentialism for that matter. Come back. It's hard to talk the way I used to. I used to come and talk about communication skills, and I would give lectures about it. And I spent so much of my time where parents would say, I tried all of that. I mean, that's the inevitable point. I'll teach a parenting principle, and 5 parents will say, I tried that. And so it's taken me a while to learn, those principles help. But they help in a different way. They help to change the parent. So if you've tried it, then you're happier. If you've tried it, you're less anxious and you're more at peace. If you've done it to the extent that you've done it, you're more confident. Because as this quote says below here, parenting skills are not for changing children, they're for changing parents. And this change in the parent can have, this change that comes from our skill practice, can have a powerful, positive impact on our children. We have the webinars on the communication skills, which I want everybody to look at. We have the webinars on other parenting principles and skills. I want you to watch the ones that apply to you. But remember, you could be the most articulate communicator in the world, and it doesn't mean that the other person's going to do anything different. Doesn't mean that everything's going to go the way that you want it to. And that's not the goal of it. The goal of it is to get clear. The goal of it is to be connected. The goal of it is to be aware. The goal of it is to begin to understand what's going on for you in relationship to others in terms of the communication skill. So part of what I wanted to share is what it's like to come. If you can get to a parent meeting, even if we have them in San Francisco, Los Angeles, I did in Chicago, we're going to go to Seattle after the first year. I think I have the slides up here at the end. Here are the upcoming ones. We're going to spread them out over the country. If there's a reason, if you have a friend in San Francisco, if you wanted to go to DC and then go down to Baltimore for the meeting, if you want to go to New York City and see a play, try to come to. Don't just come. Don't. It's a lot of pressure if you travel 500 miles just to go to a 2-hour meeting. But if you can find an excuse, another way to be there, I think it can be very beneficial. And if you can't come, go to your local Al-Anon meetings. Go to this slide. Go online, find out meetings, walk into these places that you never wanted to walk into. We want you to go to 6 while you're here. And they say 6 because they want you to give it a chance. And that's what I would say about our parent meetings, is go at least 6 times. And if you're 1 week into this, or this is your first one, it's probably going to be weird. But after 3 or 4, you'll be like, I get it now. And you'll see the people that are like, what are we talking about? Why are we talking about this? This is not the thing. The thing is my child's a drug addict. How do I deal with it? The thing is my daughter's cutting. How do I deal with that? How do I get, what am I going to do? How can I help her to stop? That's not what we talk about, at least directly. We talk about changing you, and then we can talk about the powerful impact that it has on others. I can do role plays. I can answer questions with those. I can show you what it would look like if you were in a healthy relationship with yourself and with the other. Not that it's easy to do, because so much, we were talking last night after the meeting, so much of what I say is repetitive. It's not 1,000 messages, it's probably 10, with maybe 3 or 4 at the top. But it's so hard to do for all of us. And this is why I know something about it, is because I struggle with it. And I think about it from 1,000 different perspectives in this process. So, anyway, those are my thoughts about parent meetings. I'm open to any live questions. You can also send in questions in advance or afterwards to webinar@drbradreedy.com. Prior to sending my son to Second Nature, I'd already been active in Alcoholics Anonymous for many years. However, AA is not the same as Al-Anon or other 12-step groups. Do you recommend attending a group where the common focus is a lack of control over another person's behavior rather than one's own, which would be the case in AA or NA? Yes. I think absolutely. In fact, let me tell you something about this. I love NA and AA and CA and MA and all the other A's. I wish it was required for AA members and NA members to go to Al-Anon or to go to CODA or Families Anonymous. I wish it was required. I see so many people that I know that are in recovery for substance and the program is saving their lives. Right? I see so many people there, and I think there's this codependent thing. There's this relationship issue that's just everywhere in your personality. And it's almost like, even if you didn't have a child that was out of control, it's almost like I would want everybody in NA and AA to go to a meeting to say, oh, the problem is much more foundational, much more fundamental, much more of a core issue than the substance itself. The substance itself is the way it manifests itself, and to me, most dramatically. But yes, absolutely, not even if you had a child that was behaving in a way that was harmful and destructive. And like Second Nature, I believe, I don't think it's the only road to Rome, but I think it's valuable for anybody. And I read the Daily Reader, Language of Letting Go, and that's applicable to a lot of people, and it's very general, and it's very much foundational. So my answer is yes, yes, yes. Even if you didn't have a child, I would encourage you that if you had brought it up. And it's different. And after a while, of course, you can begin and we can begin to see the relationship between the sharing in AA and the sharing in Al-Anon. We can say, okay, there's differences here. Kids in the group say it all the time. I don't have a drug that I'm addicted to, but I am addicted to anger, or I am addicted to lying, or my drug of choice is, deception, or cutting, or my parents and the conflict that we have. They can begin to see that. And I think a powerful sign of mental health, or maybe advanced mental health, is when we can see the similarities between ourselves and our problems and other people and their problems instead of the differences. I think that's, along with laughing at yourself, I think that's one of the 5 most profound signs of mental health, is being able to see the similarities between yourself and others rather than the differences. I would like to send a message of love and understanding to all my fellow parents who are living through the holidays with their children in treatment. Love to you all. Thank you. My son was in here for the holidays also. By the way, while I am off next week, you can look at the webinar. You can look at the webinar archives, obviously, but look at the one on the holidays might be helpful for you. A quote from my son, who was at Second Nature this fall, that stuck with him and helped me when hearing all the advice from so many people, well-meaning people, of course. If it fits, let it stick. If it doesn't apply, let it fly. Absolutely. It's one of our mantras in our program. They get good at that. And at first they think they're going to have to defend everything, and after a while they're like, they can listen to any bit of feedback. And they're like, okay. And how admirable is that, right? But they get really good at it. They get used to it, and they get not threatened by it anymore. It's part of what we tried to accomplish in the Milan group, where everybody sits in a circle and talks about each student one by one in the previous week with feedback and praise and identifying issues and dynamics and so forth. So, all right. Thank you, folks. Here's the webinar. Here's the website addresses to go to find meetings in your area. Please go to 6 while your child is at Second Nature. Please subscribe if you participate in any social media, because we do announcements there. We do quotes. There's our new foundation can be connected to Second Nature programs. We also have a Twitter feed, and we have YouTube and Facebook. I was going out of order. And then we have our blog, and Melanie, who's running our blog, is doing a great job, and our staff and our therapists are doing a fantastic job contributing to it. So thank them for that. Here's upcoming. Jennifer Graham will be running the one in Orange County this month, and then I'll be in Baltimore, New York, Marin, Los Angeles, Orange County, and there's the 2-day parent workshop. People praise these. If you can make this, go to these things. The Second Nature Entrada Parent Workshop, January 17th and 18th, hosted by Dr. Paul Goddard, and he's wonderful and interesting and funny and charismatic and engaging. Please go to this. It's fantastic. It's 2 days. And I'll just say that this goes to this and to all of our meetings and to all of our education. You want sustainable long-term gains? Do this work. It's hard to describe until you do it, but it changes the sustainability of the progress for the entire family. So if you can possibly go to that meeting. And here are all the email addresses for us. If you have a... what's the one, Steve? I think the one for the general questions about this, I guess it could just be... I guess you could write anything to a webinar at drbradreedy.com. And I promise I'll get a Houston one scheduled. I'm also going to schedule at the beginning of the year. And I promise the person who's on the webinar tonight that I will get in touch with you and talk about something after the first year for Seattle. So I'm going to be heading up to Seattle. So thanks for welcoming me up there. The next webinar will be Thursday, January 1st. Like I said, 2015. I'm off next week and don't get back in town until the day before New Year's Eve, and I don't want to do one on New Year's Eve. So that's what we're doing. Take the time to peruse the library this week. Look at the one on the holidays. Breathe through the holidays. The grief and the investment in this holiday is for all the future holidays to come. That's what you're doing. That's what your child is doing. So good luck getting through it like all of us do sometimes. All right, folks, have a great evening. Thanks for joining us. Thanks for all your questions. Thank you for the large crowd tonight. Thank you for Steve Kirk for being my moderator this evening. Have a great holiday season. Happy Hanukkah. Merry Christmas. Happy New Year, and I'll see you in 2015. Take care.